The fluorescent lights hummed their mechanical song above the oncology ward at Sacred Heart Hospital in Raleigh, a steady drone that most people stopped hearing after their first shift. Hannah Clarke heard it the way a combat veteran hears a helicopter in the distance, as data, as information, as something her nervous system had learned not to ignore. She moved through the corridor with practiced efficiency, her scrubs pressed, her badge clipped at the precise angle that wouldn't catch on door frames, her shoes making no sound on the tile floor because she had learned long ago that sound was a liability. Every room she entered, she noted the exits. Every room she left, she had already identified the next one. This wasn't paranoia. This was muscle memory. In room 447, Army Sergeant Michael Torres lay in the hospital bed with the kind of stillness that comes from chemotherapy and morphine. He was 24 years old with stage 3 lymphoma, his dark hair growing back in patches after his last round of treatment, his eyes carrying the peculiar exhaustion of young men who had already seen too much. Hannah checked his full line, a peripheral access in the left forearm, secure, no infiltration, and pulled up his chart on the tablet mounted to the wall. Vitals stable. Pain levels controlled. The medication notes from the night shift indicated appropriate dosing intervals. She moved with the kind of fluid precision that came from muscle memory, each gesture economical, nothing wasted. Dr. Hargrove watched from the doorway, his presence like a shift in air pressure. She had worked at Sacred Heart for 18 months. Her personnel file was suspiciously thin, education verified, nursing license clean, no references beyond the staffing agency that had placed her. She had arrived in Raleigh on a Tuesday morning with 2 suitcases, a state ID, and a letter of employment from an agency that specialized in placing temporary clinical staff. No one had asked why a woman with her clinical competence would accept a permanent position on a medical ward instead of advancing into administration or specialty care. She had learned that people rarely asked questions when someone was willing to work the difficult shifts without complaint. The night shift. The weekend shifts. The holidays. She had taken them all. "Sergeant Torres, how are you feeling?" Hannah's voice was soft, practiced, careful not to project authority even as she asked the question with the precision of someone conducting a formal assessment. She knew his answer before he gave it. She had been reading his emotional baseline across 3 weeks of shifts, tracking the micro-expressions, the hesitations, the way his breathing changed when pain began its inevitable climb. Torres paused, his jaw tightening. Pain's getting ahead of the schedule again. Around a 7 right now. She had already anticipated this. The medication intervals were working, but his body was adapting faster than the protocol allowed. She would need to speak with Hargrove about adjusted dosing. She had the clinical justification ready, pharmacokinetics, body weight adjusted for his current nutritional status, the documented literature on lymphoma patients' accelerated metabolic processing of opioid medications. Facts. Numbers. Medical rationale. It was the only language that mattered in institutional environments. "I'll speak with Dr. Hargrove about your dosing schedule," Hannah said, and that was when she reached inside her jacket to adjust the faded unit patch sewn into the lining of her jacket, a gesture so small that no one noticed it. The patch was threadbare now, its embroidery barely visible, its colors faded to the point where it looked almost like a shadow beneath the fabric. She had sewn it there 18 years ago, the night before she had walked away from her service as Senior Chief Petty Officer. It was the only physical remnant of the woman she had been, the only object she kept that carried the weight of her former life. The patch bore the insignia of Task Force 121, a JSOC unit that officially did not exist in public records, though it had existed very much in her muscles and bones and the architecture of her memory. Her hands trembled. But only for one heartbeat. She steadied herself by gripping the medication cart, and the tremor vanished like it had never been. She had learned long ago that trembling was a luxury that senior operators could not afford, and even though she had surrendered her rank and her uniform and her clearance, the training remained. The composure remained. The absolute control over her body's involuntary responses remained. "Torres," she said, her voice dropping slightly, "when's your next family call scheduled?" "This evening. My sister calls from Charlotte every Sunday around 6. "Good," Hannah said. Make sure you take that call. Family is, she paused. She had been about to say something else. Something that belonged to her old life. She corrected course. Family matters. For pain management, social connection is as important as medication. What Hannah did not say, what she had never told anyone at Sacred Heart, was that she had seen Sergeant Michael Torres before. She had seen him as a 6-year-old boy screaming in the rubble of a collapsed schoolhouse in Marja, Afghanistan, nearly 2 decades ago. She had been there as part of a classified operation that her family still believed was a humanitarian engineering project overseas. She had been clearing the building when the second story came down. She had dug through the debris with her hands until they bled, and she found him, a child in a uniform too large, a boy who had somehow survived in a pocket of air beneath concrete and rebar, and the bodies of children who had not been as fortunate. She had carried him out. She had called in a medevac. She had held pressure on his head wound while the rotor wash of the Black Hawk buffeted the courtyard, the noise like God's own industrial machinery descending from the sky. She had never known his name. She had filed reports that were classified beyond her ability to follow up. She had completed her tour and cycled through the rotation of deployments like all the others until the nightmares became so consuming that her commanding officer had pulled her from active duty and asked her very directly if she wanted to continue serving or if she wanted to step away before the PTSD consumed her entirely. She had chosen to step away. She had become Hannah Clarke, RN, and she had buried Senior Chief Petty Officer Hannah Clarke so deeply that she had sometimes wondered if that woman had ever truly existed. But Torres's military insignia on his hospital gown, Army, not Marines, but still, had triggered something in her recognition memory. The way he held his shoulders. The specific configuration of his trauma. The quiet dignity even in pain. She had pulled his medical history before her shift began. She had read his admission notes. She had seen the timestamp of his birth, had done the mathematics in her head, and had arrived at the only possible conclusion: this was the boy from Marja. This was the 6-year-old she had pulled from the rubble. Dr. Hargrove was still standing in the doorway, his expression unreadable. He was a tall man with the kind of presence that came from inherited authority. His father had been a cardiologist, his grandfather a surgeon. His family had donated the Hargrove wing to Sacred Heart in 1987. He had the bearing of someone who had never questioned whether he deserved the space he occupied. He held his phone in his hand, and Hannah saw his eyes track the way she had adjusted the medication cart, the way her clinical assessment had been precise and methodical and utterly without any emotional content beyond professional competence. The phone was already in his hand. She could not know what calculation was occurring behind his eyes. She could not anticipate the decision he was about to make. But she would have recognized, if she had been trained to notice such things, that the moment when his fingers began to move toward the screen was the moment when the machinery of institutional destruction had begun to turn. "Nurse Clarke," Hargrove said, his voice carrying the tone of someone making a statement intended for an audience beyond the room, "would you step into my office? We need to discuss your clinical protocols. There seem to be some inconsistencies in your documentation." "Of course, Dr. Hargrove," Hannah replied. The words came out soft, deferential, exactly as they should. She had learned 18 months ago that survival in civilian institutions required becoming small enough to disappear. She had learned it so well that most people at Sacred Heart assumed she had no spine at all. She did not see the way Dr. Hargrove's jaw tightened as she walked past him, did not notice the slight tremor in his hands, not the tremor of fear or uncertainty, but the tremor of frustration that came from encountering someone who refused to react the way he expected them to react. He had seen her competence. He had seen the way the patient responded to her presence. He had seen the kind of clinical authority that should have required a decade of experience and several advanced degrees, and she had done it all while wearing scrubs and a hesitant smile. But that wasn't the worst part. The worst part was that he had no idea who he was standing next to. Hannah walked toward the office with the same measured pace she always used, her shoulders slightly forward, her eyes down. In her jacket pocket, her hand brushed against the faded unit patch one final time. She had spent 18 years becoming invisible. She had spent 18 years learning to be forgotten. She had constructed this identity with the same precision she had once used to construct operational security in hostile territory. She had no way of knowing that Torres, drifting in and out of consciousness after his evening medications, would begin whispering her name. She had no way of knowing that a Marine veteran named Marcus Webb, working in the hospital's IT department, had already noticed Hargrove's attempts to access and delete security footage. She had no way of knowing that everything she had buried was about to be dug up. The moment Dr. Hargrove closed his office door behind them and turned to face her, the machinery of her old life began, inexorably, to turn. Dr. Hargrove didn't knock. He pushed through room 447's door with the kind of velocity that made the hinges protest, his white coat billowing like a cape behind him. The morning light caught his face at an angle that emphasized the jaw clench, the compressed lips of a man about to perform. Torres's mother stood at the bedside, her hand wrapped around her son's forearm. His sister occupied the visitor's chair, a tissue box balanced on her lap like some fragile, necessary thing. They looked up. All three of them. Hargrove's eyes found Hannah first, a surgical assessment, the way a hunter catalogues prey. Then he turned to the family with the expression of someone about to deliver terrible news, except the terrible news was about her. "Nurse Clarke," he said, and his voice carried the weight of a verdict already rendered. "Did you administer morphine to Sergeant Torres without my explicit written approval?" Hannah's hands were steady. She'd kept them steady through worse than this, though no one in this room would ever know that. She glanced at Torres, his face grey with pain, the monitors tracking his oxygen sat at 91%, the 4 lines she'd placed 3 hours prior still running clear, and then back to Hargrove. The pain management protocol allows for registered nurses to adjust dosing within established parameters when. "I don't care what protocol you think applies, Nightingale." His interruption was surgical. Precise. He'd chosen that nickname deliberately, let it land in the silence like something contemptible. "This is my ward. And your cowboy nursing puts patients at risk." He turned to Torres's mother, and his voice shifted into something gentler, something performative. "Mrs. Torres, I sincerely apologize that your son has been subjected to this nurse's freelancing during such a critical time in his care." Torres tried to push himself up on his elbows, the 4 lines stretching taut. "Sir, she didn't, she helped with the pain." Hargrove raised a hand. It was a small gesture, but it worked. The gesture of someone accustomed to being obeyed. "Save your strength, Sergeant. That's exactly what we're trying to preserve here." Hannah took one measured breath. She felt the tear form, not from emotion but from something deeper, something involuntary, the body's response to a kind of violence that left no marks. She let it escape down her cheek and wiped it away without breaking eye contact with Hargrove. Her voice, when it came, sounded like steel wrapped in silk, the kind of calm that comes from having already survived the worst. "I've stood in the chain of command while better men than you bled out in my arms, Doctor." The room froze. Torres's mother's fingers tightened on her son's arm. His sister's breath caught audibly. Hargrove's jaw tightened so hard she could see the muscle flex beneath his skin, and for a moment, just a moment, something flickered across his face that looked like uncertainty. It passed quickly, replaced by something sharper, the knowledge that she would not break, which meant he would have to break her instead. He left without another word. The door closed behind him with a soft hiss of pneumatic dampening, and the silence that remained was the kind you could feel pressing against your eardrums. The break room was functionally antiseptic, beige walls, a refrigerator that hummed with the distracted persistence of a machine that had given up trying, a microwave that smelled like overheated plastic and forgotten lunches. Hannah pushed through the double doors at 12:48 p.m., her tray balanced, turkey sandwich, apple, the small container of Greek yogurt she always chose, water bottle. She'd been working here long enough to know the rhythm of the lunch rotation. This was the window when the oncology nurses actually sat down instead of eating while charting. Amy was already there. So were Keisha and Jordan. 3 of the 5 nurses who rotated through this unit, the ones who'd actually looked at Hannah during morning briefing, the ones who didn't avert their eyes when she passed in the hallway. They were clustered at the far table, but they saw her enter. Their eyes met her eyes for a fraction of a second, that's all it took, that momentary contact that said, "I'm sorry, I can't, I have to," and then they moved. All three of them at once. Not dramatically. Not in an obvious exodus. They gathered their lunch containers with practiced casualness, made small-talk comments about charting backlogs and afternoon appointments, and left the break room while Hannah's tray was still in her hands. She sat alone at the center table. The sandwich was decent turkey. Sacred Heart actually had decent food service, but it tasted like nothing. Hannah chewed anyway. There was a poster on the wall behind her advertising a mindfulness workshop. Live in the present moment. She could hear Hargrove's voice drifting from the hallway beyond the break room door, speaking to someone in that lowered, confidential tone that meant he was building something. "She's been written up twice at her previous facility," he was saying. "I'm only telling you because patient safety matters. I have an obligation." Previous facility. Hannah had worked exactly one facility before this, 5 years ago, for 6 weeks before her back injury flared and she'd needed to move south. No write-ups. No incidents. But the beauty of loose records and agency transfers was that the narrative space between the facts was wide enough to drive a reputation through. She finished the yogurt. Drank the water. By the time the shift change bell rang at 3 o'clock, the unit's public communication board, the one where schedule changes and announcements lived, had acquired a new document. Hannah was in the med room, cross-checking medications for her next rotation, when the entire unit seemed to pivot toward the board at once. It was the kind of movement that happened in hospitals, staff drifting in that direction like compass needles finding north. She didn't move to look immediately. She finished her verification, dopamine, 50 milligrams per milliliter, serial number logged, and then walked to the hallway with the same pace she would have used anyway. The write-up was printed on official hospital letterhead, laminated, pinned with institutional force. Employee disciplinary action. Name, Clarke, H. Date, current. Citation, failure to respect chain of command. Unauthorized medication administration. Final warning. Hargrove had signed it. So had Patricia Dennison, the board member Hannah had seen once at a hospital function, the one who'd nodded politely when introduced. 20 staff members were reading it. Hannah could feel them reading it. She could feel the weight of their eyes in her peripheral vision. She didn't stop. Didn't acknowledge the board. Didn't acknowledge them. She walked past it the way she would walk past a fire exit or a supply closet, something that existed in the space around her but had no claim on her attention. What they didn't know was that she was counting exits. That the small, precise part of her brain that had learned to operate under fire was already calculating ratios and vectors. What they didn't know was that standing in front of that board felt like standing in front of an office in Kandahar, waiting for paperwork that would determine whether she stayed or deployed back to the field. The only person watching her reaction was Marcus Webb. He stood in the security office 3 floors above, his Marine Corps tattoo visible beneath his rolled sleeve, an eagle, globe, an anchor in faded black ink that meant someone in this building knew what it meant to be responsible for more than just the paperwork. Marcus had been reviewing security footage as part of routine maintenance. He'd noticed Hargrove's pattern over the past 36 hours, 3 separate visits to the medication room when no pharmacy work was scheduled, twice checking the locker area where Hannah stored her jacket, once standing in front of her assigned cubby long enough that Marcus had adjusted the camera angle for better resolution. Marcus had started downloading files. Not because he had all the pieces yet, but because he'd learned in Fallujah that pieces mattered more than the complete picture. He'd learned that patterns were weapons. Hannah's shift ended at 8 o'clock. Room for 47 was darkened when she did final rounds, Torres sleeping the kind of medicated sleep that was less rest and more cessation. The monitors tracked him steadily, oxygen sat 90%, heart rate stable at 82 beats per minute, the rhythm of someone healing despite everything. She adjusted his blanket. Left the call button within reach. Didn't write anything in the chart beyond what was required. The cemetery was 20 minutes south on Route 54. She didn't go home first. Just drove, the hospital radio station shifting into evening programming, some host discussing community events and lost pets. David's grave was in the older section where the oak trees were actual old, not 50-year-old saplings playing at permanence. The headstone was dark granite, simple, nothing that suggested he'd been the only person on earth who knew fragments of her truth. Hannah knelt in the grass. The earth was still damp from last night's rain. She touched the stone the way some people touched prayers, and her hands trembled, not from fear but from something anterior to fear, something like rage or grief or the specific exhaustion that came from carrying a weight no one was supposed to know existed. "I tried to be small enough to disappear," she whispered. "And I failed you again." The oak trees offered no answer. The monitors in room 447, for miles north, continued their steady percussion. And at 2:16 a.m., when Torres's oxygen saturation began a slow, insidious drift toward 89%, when the machine started their careful warnings, when the night shift nurse didn't notice because she was still processing the write-up, still wondering what it meant for her liability insurance, the cascade of events that would crack everything open had already begun. The monitors in room 447 screamed at 2:56 a.m. Hannah was at the nurse's station, charting vitals from the third-floor surgical post-op, when the alarm cut through the darkness like a blade. Not the gentle reminder of a routine alert. The urgent, metallic shriek that meant something had stopped working inside a human body. She didn't look up from her chart. Didn't need to. The cadence told her everything, the oxygen saturation alarm, cycling faster, faster, urgent, urgent, urgent. She was moving before her conscious mind caught up. The chart dropped. Her hands were already moving toward the crash cart stationed near the main desk. Around her, the night shift stirred, the charge nurse lifting her head, the resident in the break room looking up from lukewarm coffee, the sleep-deprived medical student checking her phone for the time. Everyone else processed. Hannah simply acted. Room 447. Sergeant Torres. The monitors displaying the story in red numbers that dropped like a man falling, 94%, 92, 89, 86. 90 seconds. That's all it took for his oxygen saturation to plummet from safe to critical. She was through the door and the scene registered in 3 seconds flat. Torres's chest was rigid. His ribs weren't moving with the ventilator's assist, they were locked in place, fighting the machine. His neck veins were distended, purple cords straining against his skin like they were trying to escape his body. His face had taken on the grayish-blue tone of someone drowning on dry land. The machines around him painted the picture of a man whose lungs had filled with air that had nowhere to go, building pressure against his heart, collapsing the vessels that fed his brain. Tension pneumothorax. She knew the signature as intimately as she knew her own heartbeat. Decreased breath sounds on the left side when she listened for half a second. Tracheal deviation. The clinical presentation was textbook, but textbooks didn't capture what happened in the next 90 seconds if she did nothing. The pressure would continue building. His heart would stop. His brain would die from lack of oxygen. The legal paperwork would be filled out in hospital policy fonts, and no one would question a thing because she'd followed protocol, waited for physician approval, let the system work the way it was designed to work by people who'd never had to choose between protocol and a human being gasping for air. The on-call resident was in surgery on the 3rd floor. The attending in charge of the ICU was unreachable at home. She'd know that without picking up the phone. It was 2:06 a.m. and Dr. Hargrove had made his position clear on the ethics of waking him for anything less than a patient coding in the unit. Hospital protocol required physician approval for any invasive procedure. Any invasion of the chest required documentation, chain of command, written orders. Torres' saturation dropped to 71%. His lips turned blue at the edges. Hannah moved like she was underwater and fire at the same time, calm and urgent simultaneously, muscle memory taking over with the kind of precision that only came from having done this before under considerably worse circumstances. The crash cart was beside her. The 14-gauge needle was in her hands before her conscious mind finished processing that she'd made the decision to act. Not a request. Not a prayer to a system that had already decided she was reckless. A choice. She identified the second intercostal space at the midclavicular line, the exact placement taught in every emergency medicine course, and burned into her muscle memory from 3 tours where this procedure happened in sandstorms and firefights, in conditions where there were no monitors and no backup and no appeals to protocol. Just patience and decisions and hands that knew what to do. She prepped the site with an alcohol swab. The antiseptic smell cut through the room like a blade. The needle went in. The hiss of air escaping was the sound of pressure releasing, of physics correcting itself, of a man's lungs suddenly able to expand again. Torres gasped, a long, terrible, beautiful inhalation that filled his chest and fed his brain and meant he wasn't going to die in the next 30 seconds. She held the needle steady for another breath, then withdrew it, leaving the catheter in place. A temporary fix, but a fix that meant he'd survive long enough for the real intervention. His oxygen saturation began its climb immediately, 72, 75, 79, 82. His color was returning. The gray-blue fading to actual human pink. Hannah moved to the bedside monitor and began charting the procedure. Her handwriting was perfectly steady. Not a tremor. Not a shaky line. The same precise, controlled script she used for every other entry, documented at exactly 3:02 a.m. Emergency needle decompression. Indication, tension pneumothorax. Procedure, 14-gauge angiocath needle, second intercostal space, midclavicular line. Result, immediate restoration of sinus rhythm, oxygen saturation recovery to acceptable range. The room had gone dead silent except for the soft percussion of the monitors, their tempo now reassuring instead of frantic. Torres's chest rose and fell. Rose and fell. Breathed. At 3:12 a.m., the elevator dinged down the hallway. Hargrove arrived, called by the charge nurse per protocol, his face carrying the particular fury of a man summoned from sleep. He stepped into the room and took in the scene in less than a second, Torres breathing normally, Hannah at the bedside, the chart already completed, everything handled, everything stable. His eyes went cold. The kind of cold that had nothing to do with temperature and everything to do with power slipping out of his hands. "You just ended your career," he said. Not a question. Not even particularly loud. Just a statement, delivered with the certainty of a man who knew exactly how to weaponize the system. Hannah continued charting without looking up. Her pen didn't stop moving. Hargrove left the room and made his phone calls. First to Gerald Pierce, the hospital administrator who'd agreed to accelerate the termination case 3 days ago. Then to the charge nurse, confiscate her badge pending investigation of an unauthorized invasive procedure. Then to his attorney, whose voice on the other end of the line sounded almost gleeful at the prospect of a genuine case of insubordination, a procedure performed without physician oversight, a violation of chain of command so clear and documented that no reasonable person could defend it. The dawn came grey and cold over Raleigh, and by the time it arrived, Hannah Clarke was standing in the employee locker room, her hands touching the faded unit patch sewn inside her jacket lining. The only remnant of the woman she used to be. The only evidence of the person she'd spent 20 years trying to bury. Security was waiting outside the locker room. They didn't make eye contact. They'd been given instructions not to. They simply walked her to the employee exit, the same door she'd walked through 17,000 times over 18 months, and watched her disappear into the morning rain. But that wasn't the worst part. The worst part was that she'd saved him. That she'd done exactly what she was trained to do. That she'd made the only choice a person with a heartbeat could make. And now the system was going to destroy her for it. What neither she nor anyone at Sacred Heart knew was that Marcus Webb, the IT specialist working the night shift in the basement server room, had already pulled footage from 3 different angles. Had already begun documenting exactly when Hargrove accessed the security system. Had already started building a timeline that would eventually prove the doctor had attempted to delete 40 hours of surveillance tape. The helicopter was already coming. She just didn't know it yet. Dr. Hargrove's hands trembled as he dialed the hospital board chairman at 6:02 a.m., his voice steady despite the tremor. "We have a patient safety crisis. The nurse in question performed an invasive procedure without authorization. Level 1 Review. Today. The chairman, still in his Mercedes heading to the country club, heard the edge in Hargrove's voice and understood this wasn't about protocol. This was about control. By 9 a.m., Hargrove had activated 17 years of accumulated favors, donors whose children he'd treated, administrators whose careers he'd mentored, colleagues whose secrets he kept locked in desk drawers with the precision of someone who understood that institutional power was built not on merit but on leverage. He sat in the board conference room with his consultant, a risk management specialist from Charlotte named Patricia Vance, her briefcase containing template termination language and a retainer agreement worth $8,400. Unauthorized invasive procedures constitute gross negligence, Vance said, her voice carrying the certainty of someone who'd ended nursing careers before breakfast. She didn't mention that the procedure had saved Michael Torres's life. She didn't need to. The language was already written. At 11:06 a.m., Hargrove made the calls to the nursing agency that had referred Hannah 18 months ago. The conversation was surgical. We need verification of her background. Any incidents during her previous placements. The agency director, a woman named Sandra Chen, pulled Hannah's file, sparse, deliberately sparse, 2 references listed, both deceased. One was listed as overseas humanitarian work. The other contact number was disconnected. Sandra felt the weight of the question underneath the question, why was Hannah's history so carefully redacted? She gave Hargrove what little she had. It wasn't much. It would be enough. By noon, Patricia Vance had drafted the termination notice, 23 pages of institutional language designed to make Hannah Clarke disappear from Sacred Heart's employment records as if she'd never existed. Failure to maintain institutional protocols. Unauthorized invasive intervention. Breach of physician-directed care standards. Insubordination. Reckless endangerment. Each phrase was a nail in a coffin Hargrove had been building since the moment he'd watched Hannah intubate a patient without asking permission, move through the oncology ward with the quiet authority of someone who'd seen worse than the inside of a hospital, hold a family's hand while Hargrove explained why their son was dying, and have them thank her instead. Hannah's badge was confiscated at 5:15 p.m. Her locker was cleared by 6:36 a.m. the following morning, her personal items, a photograph of David in his Navy dress uniform, 3 pairs of compression socks, a dog-eared copy of a nursing pharmacology textbook, packed into a cardboard box by a hospital administrator who wouldn't meet her eyes. The suspension letter was waiting on the employee portal, effective immediately, pending investigation. Her access codes were deactivated. Her email address deleted. By 7 a.m., Hannah Clarke no longer officially existed as part of Sacred Heart Hospital's workforce. The rain started at dawn, cold October rain that hammered the cemetery parking lot like artillery fire, and Hannah stood alone in front of David's headstone, David Henry Clarke, 1978 to 2019, beloved husband, her civilian clothes soaked through, her hair plastered to her scalp, water running in rivulets down her neck. She'd worn civilian clothes on purpose. No scrubs. No badge. Nothing that said nurse or healer or anything except failure. I tried to be small enough to disappear, she whispered to the granite, her voice barely audible above the rain. And I failed you again. The words hung in the wet air like accusations. David had known fragments of the truth, enough to understand why she woke screaming, why helicopters made her grip the armrest, why she could never quite explain where the scars came from. He'd loved her anyway. For 7 years he'd loved her anyway, until his heart simply stopped on a Tuesday morning while she was at work. She'd been in the break room when the code came through, St. Mary's, room 312, and for exactly 2 seconds she'd thought it might be him, that somehow the universe had decided to punish her for surviving when he hadn't. It wasn't David. It was someone else's husband. She'd saved him. Later that week, that man's wife had thanked her with flowers and a card. Hannah had thrown them away. The rain soaked through to her skin as she stood at David's grave, her hands at her sides, no trembling, no collapse, just the weight of 19 years of carefully constructed anonymity unraveling in a single night shift. I tried, she whispered again. But the rain had no answer. 3 miles away, in the basement of Sacred Heart's administrative annex, Marcus Webb sat in front of 6 monitors, his screen showing a timestamp of 4:23 a.m. that morning. Marcus had been a Marine, Force Reconnaissance, 13 years, before his left knee gave out and he'd pivoted to hospital IT security, a job that suited him because he understood the architecture of institutional power and how to read its shadows. He'd noticed Hargrove's login attempting to access the supply room security footage at 2:15 a.m. Then again at 2:36 a.m. Then at 3:11 a.m. Each attempt was a keystroke in a search for the camera angles that showed the supply room where Hannah hung her jacket, where the faded unit patch was sewn into the lining. Marcus was methodical. He pulled the access logs, watched Hargrove's fingers hesitate over the delete function, so the exact moment the doctor realized he couldn't access the deletion protocols without triggering an audit trail. So Hargrove had done something worse. He'd attempted to brute force the system, his password attempts logging automatically, a digital footprint precise as blood spatter evidence. 37 failed attempts. Each one a felony attempt to destroy evidence. Marcus Webb made 3 copies of everything, the access logs, the video feeds, the timestamp markers, burned them to separate encrypted drives, and placed them in 3 separate locations, his home safe, his mother's house in Durham, and a safety deposit box at Bank of America on Fayetteville Street. Then he called hospital administration. The administrator who answered, a vice president named Linda Martinez, heard the calm certainty in Marcus's voice and understood immediately they had a doctor attempting to destroy evidence. She didn't ask what evidence. She knew. Everyone knew. By 10 a.m., she'd called the hospital's legal team. By 11 a.m., the board chairman had called the FBI. But Hannah didn't know any of this. Hannah stood in the rain at her husband's grave, water streaming down her face, and said nothing else. She just stood there, the cemetery empty, the granite headstone colder than bone, the inscription carved deep enough that no amount of rain could wash away the dates. She stood there until her teeth chattered, until her fingers went numb, until the rain soaked so completely through her clothes that she felt like she was dissolving into the earth beside him. That was where she would have stayed, probably, chest deep in the Georgia clay, matching her husband's coordinates, except that 3 days later, a new patient arrived in Sacred Heart's ICU with a diplomatic security detail and a chart flagged for federal jurisdiction. His name was Khalid Rahman. He was 43 years old. He had surviving family members who wanted him dead. And when they wheeled him past Hannah's civilian clothes hanging in a supply room, suspended between shifts, the faded unit patch sewn carefully into the jacket lining caught the fluorescent light like a small, stubborn star refusing to go out. The hospital corridor felt different now. Wider somehow. The fluorescent lights buzzed overhead with the sound of 1,000 confessions waiting to happen. 3 days had passed since Hannah's suspension, 3 days of silence and rain and the weight of a life half-lived. She moved through the ICU on a contraband visit, not yet cleared to be here, but some boundaries had already been crossed when you'd buried yourself 6 years in other people's pain. Room for 47 still held Sergeant Torres. But the ICU had received a new patient that morning. The admission papers marked him with flags, diplomatic security detail, refugee status, asylum approved through federal channels. His chart bore a single red sticker. Threat assessment, pending. The man lay in room for 51, sedated under morphine, his dark eyes half closed as the drugs pulled him down into that soft place between memory and forgetting. Hannah was checking the monitors when those eyes opened. When they focused. When recognition bloomed across his face like a wound reopening. His mouth moved. First in Pashto, guttural, rapid, a voice dragged up from somewhere deep and wounded. Then English, fractured but unmistakable, you are her. The woman from Marja. The one who killed Razak and saved the children. The room went dead silent. Hannah's hands didn't tremble. Her breathing didn't hitch. She simply stood there, a nurse checking a monitor, as 20 years of burial collapsed into a single moment of unraveling. The morphine was loosening his tongue, pulling truth up from the place where he'd hidden it, the way the drug pulls pain to the surface so it can finally be released. You remember, she said. Not a question. A statement flat as a field after ordnance stops falling. The schoolhouse. Fallujah, no, Umayyah. His eyes squeezed shut. You came through the dust. You carried them out. All of them. Even me. I was 6. I thought I was dead. I thought, his voice cracked. Thank you. Thank you for. Hannah placed her hand on his shoulder. Rest now. She turned toward the door, and that's when she heard the footsteps. Fast. Purposeful. Torres appeared in the doorway of room for 51, still in the discharge clothes his family had brought him, his young face already carrying the weight of survival. Behind him, the lobby beyond fell into a strange, expectant silence. That senior chief petty officer Clarke, Torres said. His voice carried the precision of someone who'd finally understood what he was saying all along. She carried me out of that school in Umayyah when I was 6 years old. She's the one who saved my life then. And she's the one who saved it last week. The words hung in the air like rounds still traveling toward their target. Hannah's jaw tightened. Just slightly. Just enough that someone who knew how to read tension could see the control it required. She reached down and opened the personnel file that had been delivered to her apartment that morning, the envelope bearing a JAG officer's seal, the papers inside marked with classifications that belonged to a life she'd spent years pretending didn't exist. Navy Cross. 2 silver stars. Presidential Unit Citation. Operations in Helmand Province. Operations in Jolon District. Operations across 7 countries, 23 years, 2 lives, 1 buried, 1 finally rising. The file felt heavier than it should have. A lean man in aviators stepped into the ICU corridor. Commander Price. Same sharp eyes, same posture like a man built from intentions and steel. His presence made the air pressure change, the way it does when you're standing next to someone who has already survived the unsurvivable and decided to come back for others. Senior Chief Clarke, he said, his voice carrying through the lobby like a command spoken in a room full of ghosts. It's been 6 years. The Navy Cross for Valor during Operation Kestrel in Umayyah, 2003. 2 silver stars for operations in Helmand Province, 2005 and 2007. Presidential Unit Citation as a member of SEAL Team 3, Charlie Platoon. 3 tours. 7 countries. 417 lives saved in civilian medical operations across 3 continents. He paused. Each word sat in its own space, its own consequence. Welcome home, Senior Chief. Dr. Hargrove emerged from the nurses' station behind them. His face went white first, that particular shade of white that comes when you realize you've been pushing on a door that was never locked, only waiting for someone to open it. His hands gripped the edge of the counter so hard his knuckles blanched. 2 FBI agents appeared from the stairwell. Then 3 more. They moved with the practiced calm of people who'd done this before, who understood the precise physics of institutional collapse. Dr. Samuel Hargrove, one of them said, "We need to talk about your background investigation into Hannah Clarke and your attempts to access secure hospital surveillance systems. And about the personnel file you were never supposed to see," another added. Protected identity status. Credible threats from surviving enemy networks. You triggered a federal security breach. Marcus Webb stepped forward from the cluster of hospital staff. He held a laptop. His face was steady as a sniper scope. He pulled up a timeline, 40 hours of surveillance footage compressed into graphs and timestamps. Hargrove in the supply room at 3:08 a.m., hand shaking, trying to access the network security box. Hargrove at his office computer at 4:22 a.m., attempting to delete files that auto-backed up before his cursor even left the keyboard. Hargrove making phone calls to Hannah's references at 5:15 a.m., his voice on the audio files calm and poisonous. "You were building a case," Marcus said. His voice was the voice of someone who understands the particular violence of data, the way numbers can burn a life down to nothing. Based on a federal protected person. Based on classified operations. based on a woman whose very existence as a civilian was meant to keep her safe from people who still want her dead. The conference room filled up fast. Patricia Dennison, the board chair, her face hardening as she reviewed the evidence. Gerald Pierce, the risk management consultant, already backing away. I was provided incomplete information. I'm withdrawing from this engagement entirely. Hospital legal counsel calculating exposure like they were counting casualties. The room's silence held the weight of institutions discovering they'd harbored corruption in their own chambers. 48 hours later, Hargrove cleared out his office. The framed diplomas came down first. Then the awards. Then the photographs of his family standing beside him at ceremonies where he'd been celebrated for competence and authority that had, it turned out, been built on a foundation of lies and the calculated destruction of someone he decided was beneath him. His hands shook as he packed the last box. Sacred Heart's board met in emergency session. The legal analysis was clear: a wrongful termination lawsuit from a decorated war hero, from a senior chief petty officer with 3 tours and a Navy Cross, would destroy the hospital's reputation and donor base. The state medical board issued Hargrove a formal reprimand and mandatory ethics training but stopped short of license revocation. It was almost worse, a public acknowledgement that he'd violated professional standards without the final mercy of being removed entirely. Sacred Heart's board, however, required no such mercy. Termination for cause. Falsifying performance documentation. Attempting to destroy evidence. Creating a hostile work environment. Effective immediately. 6 months later, in a CPR fundamentals classroom at Raleigh Community College, a man with expensive shoes and trembling hands demonstrated chest compressions to a room full of bored students who didn't know they were watching the slow-motion collapse of someone who had confused authority with worth. His salary was $18 an hour. His certification required him to teach 4 times a week. The students barely remembered his name. During chest compressions, his hands shook so badly he had to pause. "Apologies," he said to faces that didn't care. Just watch the rhythm." The rhythm. The thing he'd tried to destroy. The thing that kept coming back no matter how hard he pushed. Meanwhile, Hannah moved through the hospital in a way that felt like surfacing. Her suspension was lifted. Back pay reinstated. A formal apology from the hospital board, framed and carefully worded to avoid legal exposure but genuine in its weight. She tended to Torres during his final chemotherapy sessions. His lymphoma had begun its retreat. The cancer was losing ground to a body that had decided to survive. "Why didn't you ever tell anyone?" Torres asked during his last infusion. Hannah touched the unit patch. It wasn't hidden anymore. She'd had it framed, a small glass frame, the patch visible, the stitching still perfect after all those years. She wore it clipped to her uniform now, small enough to miss if you weren't looking, impossible to ignore if you were. "I was trying to outrun the past," she said. Turned out it was trying to find me. 6 weeks later, an official White House envelope arrived at her apartment. Cream-colored. Heavy. Sealed with a presidential stamp. The invitation inside was formal. Precise. An invitation to the East Room. To be honored. To have a medal placed around her neck by hands that represented a nation's gratitude for services rendered in the dark places where gratitude doesn't usually reach. Hannah stood in her apartment, holding that envelope, and for the first time in 6 years, she allowed herself to imagine what it might feel like to stop running. The East Room held the weight of history. 300 years of decisions made inside these walls. Hannah stood there in a simple blue dress, the unit patch framed in her pocket, close enough to touch. Sergeant Torres stood beside her in full dress uniform, lymphoma in remission, his posture military straight, his eyes clear. Commander Price sat in the front row. The rest of her SEAL team, aged and honored and real, sat beside him. The president approached with the medal. The Medal of Freedom. The citation was read aloud, for extraordinary valor in combat operations and continued selfless service to those in need, demonstrating the highest ideals of military service both in and out of uniform. The medal settled around her neck like a benediction. Like permission to finally take up space in the world. Torres saluted her. A young man honoring a legend. A soldier acknowledging his superior. The audience rose. 3 months later, Hannah established the Veteran-to-Civilian Nursing Mentorship Program at Sacred Heart. Former combat medics transitioning to hospital work. People trying to learn how to save lives in fluorescent light instead of darkness. People trying to become civilians without losing themselves. Marcus Webb ran hospital security now. Coffee with Hannah weekly. 2 veterans who'd found each other. Torres visited monthly. He brought other young veterans. People who needed someone who understood what it meant to carry death close enough to touch, and then to carry life forward anyway. And in a small classroom at Raleigh Community College, a man with white-knuckled hands taught CPR fundamentals to students who'd never know that they were watching a cautionary tale unfold in real time. His voice cracked when he explained cardiac rhythm. His hands trembled during demonstrations. The consequences of attempted destruction had a way of settling into muscle memory. This is what happens when you try to erase someone's valor. The erasure never takes. The truth finds its way. And sometimes, just sometimes, a woman who spent 6 years trying to disappear into a uniform finally gets to stand in a light and be seen for exactly what she always was. Subscribe for more stories of hidden heroism. Like if you believe the quietest person in the room might just be carrying the heaviest weight. Comment below, have you ever been underestimated by someone who didn't know your real value? Because not all heroes wear capes. Some wear scrubs.